Hi, this is Dr. Sutton with MDI Prep, and welcome to another sample of the MDI Prep INBDE class. Sit back and enjoy.
So there are a few things that are going to make this topic really easy. So whenever you see cholinergics, think of acetylcholine. Okay. Now, whenever you think about acetylcholine, right? You think of, I want you to kind of get in your head to kind of think about parasympathetic, sort of. And I'll tell you what that means in just a second. I want you to think parasympathetic, but I also want you to think, when you think about acetylcholine, right? I want you to think about this thing called side effects. And we're going to use this mnemonic SLUDS, SLUDDS, okay? All right. So cholinergics, we think of what? Acetylcholine. And Dr. Rosales, what is acetylcholine? What is that?
It's not an enzyme. It's it's not enzyme, right, doctor? No.
It's on the screen.
Oh, sorry. It's a neurotransmitter.
Correct. It's a neurotransmitter, right?
Mm-hmm.
And as a neurotransmitter, where are neurotransmitters released from?
It's on the axon and the neuron.
Correct.
Yeah.
Okay, good. Right. So you have an area called the synaptic bulb, right?
Mm-hmm.
And inside of there is a vesicle. And inside the vesicle is the neurotransmitter. Okay, very good. Thank you very much. All right. And so anybody knows what causes this neurotransmitter to be released out here? Anybody know what ion?
Calcium.
Very good. Outstanding. So calcium can come in, it can bind to this vesicle, and it can cause this neurotransmitter, which we're going to call acetylcholine. It can cause this neurotransmitter to be released, okay? Once that neurotransmitter is released, you have something like a muscle, okay? So a muscle. And on that muscle, you might have what we call an acetylcholine or ACH receptor, okay? Whenever the acetylcholine binds to that receptor, it's going to open up a sodium channel at the muscle cell. That sodium will come into the muscle. And when that sodium comes in, it's going to cause that muscle to do what?
Contract.
Contract, right. And we call that depolarization of that muscle. Everybody understand that? And so the muscle will contract. I love it. Now, what would happen, Dr. Saul, if I were to block the acetylcholine?
So there'll be no depolarization happening.
And what would happen?
There'll be no muscle contraction.
And what would happen?
Basically, there'll be no action potential.
Good. So if you block ACH, what's going to happen to the muscles?
It's going to relax.
Good. So we will use the word paralysis.
Paralysis.
Okay, very good. So you see how if we block the ACH, right, from being released, and do you know, have you all heard of botulism toxin?
Yes, doctor. It's
Yes.
from
Yes, doctor.
bacteria.
It's from where?
Bacteria.
Right, from Clostridium.
Clostridium.
Yeah.
Very good. Very nice. Okay, good. So Dr. Lazo, if somebody were exposed to botulism toxin, what would you expect the patient to look like?
The muscle will look flaccid or relaxed.
Yeah, exactly. That's pretty easy, right? That's not too bad. So you might say, well, where do you get botulism toxin? Well, from a bacteria, true. So they'll tell you, like, if you ever see them say something on the test about don't give babies honey, right? Because they are susceptible to botulism toxin. Everybody understand that?
Yes, doctor.
Or,
Yes, doctor.
or watch this one: damaged food cans. So you know how you have those food cans that look like they're damaged or bent or something like that? They can be susceptible to Clostridium botulism. Everybody see that?
Yes, doctor.
Okay. And I'm sure everybody's heard of Botox, right?
Yes.
And Botox is nothing more than botulism toxin. So when they're getting that injection of Botox, guess what they're getting? They're just getting botulism toxin. That makes sense to everybody?
Yes, doctor.
Any questions on that? Nope. All right. Perfect. So since we understand that, watch how easy this is going to be. Y'all going to love this part. Okay. All right. Hold up. Let me go back. Make sure I covered all this. Okay. So the very first thing I want to tell you about is what we call this. You see this M right here? What does this M stand for, Dr. Agnes? Dr. Agnes? Dr. Olga, do you know what the M stands for?
Good night, doctor. Maybe it's mediators.
Not mediators. Good try, though. Not mediators. How about Dr. Faruza? Do you know what it stands for? All right. Dr. Lazo?
Muscarinic.
Yes, exactly. So this M right here stands for muscarinic receptor. The N right here stands for nicotinic receptor. Okay. So this is muscarinic and nicotinic receptors. Now you may be saying, okay, what's the big deal, right? Well, let me show you. So I want to point out a few things and you tell me what you see. All right, decreased heart rate. What do you think that is, Dr. Saul? Sympathetic or parasympathetic?
It's parasympathetic.
Okay, gotcha. All right, perfect. Stomach acid, Dr. Pena, what do you think that is? Sympathetic or parasympathetic?
Parasympathetic, doctor.
Very good. Okay. Dr. Rosales, meiosis, parasympathetic or sympathetic?
It's for the muscles, right, doctor? I think it's parasympathetic too.
You are correct. So do you all see this right here? Do you see a little pattern with these muscarinic receptors? Do y'all see that?
Yes, doctor. They're all in
They're all
parasympathetic.
parasympathetic.
That's right. That's right. So if you have a muscarinic agonist, right? So if you have a muscarinic agonist, then you probably thinking it may have some type of parasympathetic effect, right? That makes sense?
Yes, doctor.
Right.
Can you
Perfect.
repeat that?
Yes. So you see how these muscarinics all have this kind of like the parasympathetic stuff like bradycardia, meiosis, increased stomach acid for increased digestion. All those muscarinic receptors, whenever an agonist binds to that muscarinic receptor, it's going to create some type of parasympathetic effect.
Okay, yes, because they're agonists.
Correct. Exactly. Now, The other thing, you remember I told you earlier about cholinergics, we look at this mnemonic called SLUDS. S-L-U-D-D, right? S. And the S stands for what?
Salivation.
Salivation. Wow. So we got salivation. The L is lacrimation. The U is urination, right? The D is diarrhea. The S is sweating. Y'all see that up there? So guess what? These are cholinergic side effects. So that means then cholinergic drugs are agonists for muscarinic receptors. Does that make sense to everybody?
Yes, doctor.
Yes.
Okay.
Yes,
Now,
doctor.
please stop me if I say something you don't understand. Okay, everybody got that? Okay, perfect. So since cholinergic drugs are muscarinic agonists, right? They're agonists to muscarinic. That means that they're going to have side effects such as what we just mentioned. All right. Any questions on the side effects of a cholinergic drug?
Doctor, what about nicotinic? Are they sympathetic in action?
I like how you said that. Let's look at it. So you got nicotinic M, nicotinic N. Now watch this. Let's just look at N for a second. If you have an agonist, it's going to cause the secretion of epinephrine. Is that sympathetic or parasympathetic?
Parasympathetic.
No.
Oh, sorry, sympathetic.
That is sympathetic because
Yeah,
epinephrine is just like adrenaline, right?
Adrenaline, yeah.
And whenever we say adrenaline, we think of adrenergic. And whenever we think of adrenergic, we think sympathetic, right?
Yeah.
All right. So if you look at that one, that looks like sympathetic. Now look at the skeletal muscle, right? So contraction of the skeletal muscles is also under nicotinic control. So nicotinic is a voluntary control. You know, like typically you can't control your heart, right?
Yeah.
You can't control the smooth muscles of your GI system typically, right?
Yeah.
But you can control your skeletal muscles.
Yes.
So you see how that's nicotinic?
Okay.
All right. So the take-home message from this slide right here is that if you see muscarinic, think that cholinergic drugs have are agonists to muscarinics. Okay. All right. Everybody got that?
Thank you, doctor.
Okay. Now, since we understand that, watch how easy this is going to be. So easy, you're going to love this. This is going to almost feel like you're cheating because it's going to be that easy. Okay. What does this say right here, Dr. Agnes? This top, what does the top say?
Adverse effects and overdose signs of cholinergic drugs.
Good. So even if you did not have this slide right here and somebody said, hey, this patient overdosed on a cholinergic drug, could you tell them the signs and symptoms?
Slugs.
All right. And what would you tell me what that is?
Salivation, lacrimation, diarrhea, urination, and
Sweating.
Yep. Sweating.
sweating.
Sweating. Right. So you could say, hey, if they overdosed on that, I know that. Now, what about, could you tell me about their heart rate?
Yeah, it's going to be a high rate. It's gonna go up.
Everybody agree with that?
No,
Oh yeah,
doctor.
it's lots. It'll go down.
Slow heart rate.
It's low heart rate because we said parasympathetic, right?
Yes.
Okay, good. Dr. Agnes, could you tell me about their digestive system?
It's going to be relaxed.
I just want to know if it increases or decreases.
Decreases.
Everybody agree with that?
It increases, doctor.
Increases, doctor.
Yes. Okay,
That's
so
why there's
Dr. Agnes,
diarrhea.
Dr. Agnes, you remember when I was asking you, you sure you understood what I was talking about, right?
I remember that we were saying that some of the effects of mu receptor was the stomach acids. So yeah, I was wrong.
Okay, all right. So whenever you get a question, I always want you to think about the question first and then answer it. Okay, you follow me? All right.
Yes.
And the reason I'm saying is because I don't want you to like to memorize it. I want you to actually say, "Oh, I get it. I understand it." So you did good. So with the cholinergics, you did give me the sluds, and then you did tell me about parasympathetic. Okay, so let's see if you're right. So all right, person overdosed. All right, bradycardia. Would you expect that?
Yes.
Low blood pressure. You expect that?
Yes.
Meiosis. You good with that?
Yes.
Bronchospasm. You good with that one?
Yeah.
Explain it.
They're gonna be relaxed. That's when the bronchospasm happens.
What does that mean? I'm not sure. Explain that again.
The bronchospasm happens when the bronchos are relaxed.
Now what you remember the rule I just gave you? What did I say before you give me an answer?
Think about it.
I want you to think about it. Because you know what? I know you got so much knowledge up there, but then you say things really quickly, and I don't think you process it.
Okay.
So what are cholinergic? Sympathetic or parasympathetic?
Parasympathetic.
Gotcha. When we talked about parasympathetic, we talked about the angry bear in the house, right? Remember the angry bear comes into your house? That's going to be sympathetic, right?
Yeah, sympathetic.
But
Not parasympathetic.
right. So the opposite of that would be parasympathetic.
Mm-hmm.
So in a sympathetic response, what do you expect the bronchioles to do? Do you need more oxygen or less oxygen?
You need more oxygen because you're trying to run away from the bear.
Exactly. So do you want your bronchioles to open up or close?
Open up.
So in sympathetic, let me just write that. In a sympathetic response, you will get a bronchodilation.
Yes.
Okay. So I asked you, what is this?
Bronchoconstriction.
Right. Exactly. So bronchospasm is the same thing as like bronchoconstriction. Do you understand that?
Yes.
Okay.
So when the dilation happens,
Uh-huh.
oh yeah, then it opens up, and then yeah, I got it.
You
And
got
then
it?
yeah, the constriction is when they close, when they start getting like smaller and smaller.
Correct. Correct. That makes sense?
Yes.
Good. All right. Does everybody understand this slide?
Doctor, can you explain like quickly? I know that parasympathetic is bronchospasm. It's constriction of the bronchioles. Then what if the muscles of the lungs are relaxing? Why would it cause constriction? Okay, I'm a little bit lost on the acetylcholine releasing it and causing the muscle to relax, and too much of that.
Well, let's back up first of all. So first of all, if acetylcholine is binding to something, is it going to cause the muscle to relax or
Contract. I'm sorry, to contract. No, I get it. Okay, I got lost there for a moment. I got it. Thank you.
All right, I got it. All right, good. All right. Is everybody good with this now?
Yes, doctor. Doctor, I thought that bronchospasm, it was causing spasm of the bronchio and the lungs.
Yes. Right. And if the bronchioles are spasming, they're getting smaller.
Okay. So it has nothing to do because there is, it will get confusing. So.
Wait, do you understand? You got it?
Yeah, I understood it.
Okay. All right. Perfect. All right. So here are our wonderful mnemonics. You know, we love mnemonics. So I want you to think about two big things. You can have what we call a direct cholinergic and an indirect cholinergic. Now, if I were traveling to California and I decided to take Interstate 10 all the way to California, my goal is to get to California. Everybody follow me so far?
Yes, doctor.
That's a direct, straight shot to California, direct cholinergic. Well, I could have an indirect route where I decided, well, I'm going to take I-10 for a little ways, then I'm going to go up to Vegas, then I'm going to go from Vegas through Arizona back up to California. But I still get to California, right? I just get there indirectly, a different way. Well, I want you to think of your cholinergics as either a direct cholinergic, which means direct cholinergic means that they're basically producing acetylcholine. Okay, everybody got that?
Yes, doctor.
So a direct cholinergic is basically just going to give you acetylcholine. Okay. Now, if you were in a factory, right, and this factory produced acetylcholine, and I needed more acetylcholine, you could just give it to me. Isn't that right? Now, watch this. If you're in that same factory, and if you make too much acetylcholine and you need to stop production of it, then what you can do is you can use something to break the acetylcholine up so it doesn't continue to build up. Does that make sense?
Yes.
Okay. Now I'm going to put some terms to that in just a second. So direct cholinergics, guess what? You just give me the acetylcholine. That's direct cholinergic. Indirect cholinergic is I'm going to increase the acetylcholine because I'm going to block the breakdown of the acetylcholine. Did everybody catch that? Do I need to repeat that?
Yes, please.
Okay.
Yeah.
Okay, so watch this. All right, so direct, I'll do it like this. Direct means you just give me acetylcholine. Okay, so you got some acetylcholine in your hand. I said, hey, I need some acetylcholine. You give it to me, right? Now, indirect, watch this one. Indirect is I block, watch this, I block the breakdown of acetylcholine. If I block the breakdown of acetylcholine, my acetylcholine does not decrease, does it?
No.
It stays the same or go higher. Does everybody understand that?
Yes, now, yes.
Okay, perfect, perfect, perfect. So let's first of all talk about the direct cholinergics. So all direct cholinergic drugs either going to have the word chol in it or car. Pretty easy, right? Watch this. Bethanochol, that's choline. Carbachol, that's choline. Pilocarpine, that's another cholinergic. Methylcholine. Does everybody see that? If it has the word chol or car in it, it's a direct cholinergic. So if I ask, let's say, Dr. Saul, if I said, can you give me a side effect of carbachol? Could you do that?
The side effect of carbachol, bradycardia, meiosis.
There you go. Good. Perfect. You can go down the list, couldn't you?
Yeah.
Good. Does everybody understand that?
Yes.
Yes, doctor.
See, pretty
Yes,
easy. So we don't have to even memorize that anymore. We
Yes,
know.
now-
What'd you say?
Now it's easy for me.
Good. That's the whole. That's why we're here. Make it easy, okay? So now look at this. Watch how easy this is. So you see bothanocol, right? Look at what it does. Bile, and bladder activation. Meaning it's going to cause, if we activate the bowels, that can cause diarrhea. If we activate the bladder, that can cause urination. Ooh, that sounds just like what cholinergics do, right?
Yep.
Yeah.
Yeah, y'all see? Now watch how cool this is. Then you have another cholinergic, right? Called Evasac. See that one down there? Evasac. Now I know what you're thinking. You might say to yourself, wait a minute, that doesn't have the word what?
Call and car.
It doesn't have it in there, does it? So I know what you're saying. You're saying, well, Dr. Sutton, you told me that if I see coal and car, then that's what it is, right? But guess what? Did you know that there's another word for Eversac? Anybody know what that other word is?
Over there it says cevimeline, but it doesn't have coal or car.
It still doesn't have coal or car, does it?
No.
No.
Oh, but wait a minute. What if I
Carbocol.
say it again?
Carbocol.
Well, it's not quite carb, but it is a car. It does have the word car in it. And what it is, let me see if I can write it up here for you. Now, well, while I'm doing that, tell me, why is that good for Dr. Pena? Why is that good for Sjogren's?
Because it stimulates salivation and decreases the dryness in the mouth and the eyes.
Ah, so that means then
That is
means,
not.
Go ahead.
It means that it's specific for M3 receptors, but it acts as an adrenergic. It's not a cholinergic.
Whoa, wait a minute. So
I mean, it's
wait. You're saying this is not a cholinergic?
It is a cholinergic, but its action is working as a sympathetic, not a parasympathetic.
Hold on. You're gonna have to repeat that. I think I must have lost what you said, because say that again.
Oh, sorry, my mistake. No, it is a direct cholinergic because it's good for lacrimation.
Okay, good, because that's one of the side effects of cholinergics, right?
Yes, it's my mistake.
Okay, so whenever you see this one right here, I would normally they associate that with like pilocarpine. Okay, so sometimes you'll see this used and they'll be talking about pilocarpine, but just remember, this is one that you may not see the coal or the car, but just know that this is used for Sjogren's. Now, is everybody familiar with Sjogren's? Everybody knows what Sjogren's is?
Yeah, basically dryness.
Good. Dry mouth, dry eyes, dry bones. Everybody understand? Always remember that. Dry eyes, dry mouth, and dry bones. And let me tell you why I say it like that. Because if you have dry bones, that's called arthritis. So one of the side effects, one of the things you see in Sjogren's is arthritis. Dry eyes is what?
Conjunctivitis.
Conjunctivitis, very good. And then the dry mouth. Okay, everybody understand that?
Yes, doctor.
Yes.
All right, perfect.
Yes, doctor.
All right, good job. Okay, what is this up here? Hold up, let me go back. All right. Okay, I'm not sure what that thing is on my, hold up, let me see some real quick.
Dr. Sutton, I have a question.
Good, I have the perfect answer.
So can we go back to slide 7?
I sure will. Give me 1 second. Let me erase this thing. Okay, there we go. All right, we're at slide 7. Go ahead.
So I don't understand cevimeline on
Yep.
the last one. You all says it is like it is cholinergic, right?
Correct. It's like
But you
pilocarpine.
told,
It's like
yeah.
pilocarpine.
Okay. Now I understand. Okay, thank you.
All right, got it? Okay. All right, now watch this. This is the indirect cholinergic, right? Now, you remember I told you about going to the factory, and they have in the factory, they have this stuff that breaks down acetylcholine. Y'all remember that?
Yes.
Well, that thing that breaks down acetylcholine is called cholinesterase. It's an enzyme because it ends in ase, right? The whole purpose of cholinesterase is to break down acetylcholine. So if you break down acetylcholine, Dr. Rosales, what happens to your levels of acetylcholine?
Will be reduced.
Correct. But what if I inhibit the cholinesterase?
Will be okay. Will be not breakdown of the acetylcholine.
Good.
Okay.
So that's right. So that means then I can use something if I wanted to, if I needed a cholinergic drug and I can't use a direct cholinergic, I can use an indirect cholinergic, right? And the indirect cholinergics, look at this, they either end with stigmine, 8, or thiol. Watch this. Neostigmine, pyridostigmine, physostigmine. Watch the 8. Watch the 8. Isoflurofate. Look at the thiol. Another thione. The 8. The 8. Everybody see that?
Yes, doctor.
Yes.
Good. Good. Perfect. So that means, Dr. Lazo, what is the side effects of physostigmine?
Say it again, doctor.
Yes. What's some side effects of physostigmine?
The same as what we talked about earlier.
Like what?
Salivation, lacrimation.
There you go.
urticaria,
Perfect.
sweating.
Perfect. You got it. You got it. Perfect. Okay. Dr. Feruza, what's some side effects of melathione?
Same side effect.
There you go. There you go. Isn't that easy? Isn't that pretty
Yeah,
cool?
you know.
Yes. So anytime, now watch this. This is lovely. You got to watch this one. Anytime you see a drug, you see something that ends in the word thione, right?
Yeah.
That's
Yep.
that's an insecticide.
Yeah, you make it really easy for me right now.
Yeah, that's an insecticide.
Yeah.
What that means is that if somebody, you know how they said you got to be careful with those insecticides, and like they put those insecticides on certain plants and vegetables and things, because those insecticides can cause side effects. It can make your mouth water. It can cause diarrhea. Everybody understand that?
Yes, yes.
All right. Awesome. Perfect. Any questions? Nope. Sound good? Sounds good.
So
All right.
why would we use an insecticide?
Well, they use it to keep the
Oh, okay.
insects off the plants.
But not like to somebody that needs a cholinergic.
No, no.
Okay.
No, they don't do it like that. Okay. Now, watch this. Have you all ever heard of myasthenia gravis?
Yes,
Okay.
doctor. I've heard of myasthenia gravis.
Okay. What is it? What is myasthenia gravis?
If I remember correctly, and I'm not really sure.
All
I
right.
have an idea.
Okay. Okay? Go ahead and tell me.
So we were saying that whenever the acid the ACE doesn't release and it doesn't go to the receptor, the muscle doesn't contract, right?
That's true.
Okay,
That's
so myasthenia gravis has we were saying, if I'm not wrong, that we can see a person with myasthenia gravis, the one that like doesn't floss her teeth or doesn't do like toothbrush because they have weakness on their muscles.
That's true.
Is it muscle morbidity,
Can I
doctor?
So we can use an indirect agonist. So the ACE can bind to the muscle and help with the myasthenia gravis and help the muscle to contract.
Good. Very nice. And that's perfect. There's just a few things I'm going to add to that.